And yes, I think we are live. Good afternoon, or good morning, or good evening, everyone, wherever you are from and joining us in our webinar. My name is Marwan, and I am the Standing Committee Director of Medical Education on behalf of the International Federation of Medical Education of Medical Students Associations. I'm really happy to be here welcoming you for this webinar, which is about interprofessional education and collaborative practice in healthcare. And what is very interesting for this webinar, it is an interprofessional team that has prepared it for you so we can have and start a conversation about interprofessional collaborative practice in healthcare. And as healthcare students, we need to start by discussing our education and how it is preparing us for interprofessional collaborative practice in healthcare. Before we start, I would like for us to have our speakers for today introduce themselves today. Can you guys introduce yourselves if you'd like to?
All right, can you guys hear me?
Yes.
All right, so hi guys, hi everyone. My name is Debokhang. I am the Director of Internal Affairs from the WCCS, World Congress of Chiropractic Students.
Thank you very much. Maybe Ahmed, can you go next?
Yes. Hello, everyone, all over the world. My name is Ahmed. I'm from Egypt, and it's a pleasure to represent GASIN, the Global Association for Student and Novice Nurse, and happy to meet you. Thank you.
Great. Who else would like to join us from the speakers?
Hello, everyone.
Mm-hmm.
My name is Allison Williams. I'm from Nigeria, and I'm the chairperson of pharmacy education for the International Pharmaceutical Students Federation. I'm really excited to be here. Thank you.
Thank you.
Okay, hello everyone. My name is Abdullah. I'm the General Assistant of the Standing Committee on Medical Education, also speaking on behalf of IFMSA, the International Federation of Medical Students Associations.
Great. Thank you so much, you guys. As you have noticed in the past days, since the beginning of February, in our social media pages in IFMSA or in other pages students organizations, um, such as, for example, WCSS, GAMS, or IPSF, or the other healthcare students organization. They have been conducting an interprofessional campaign about interprofessional education and collaborative practice in healthcare. And this webinar today is of one of the many steps that we are taking in this campaign, so we can raise awareness of all healthcare students worldwide about the importance of interprofessional collaborative practice and how can our education basically provide many strategies in our curricula so we can learn about interprofessional practice in our future. So this webinar will have uh, this agenda points that we are going to talk about. So first of all, we are going to talk about the why we need interprofessional collaborative practice in healthcare, and it's mainly about patient-centered care. And then afterwards, we are going to discuss what is interprofessional practice, its definition and its role. Afterwards, how can it be discussed in healthcare education, and then we can see more what kind of good practices that we have regarding interprofessional education from different universities worldwide. And then we can have a small discussion about what can we as healthcare students implement IPE, and what can we do in this matter? Can you- Alrighty then. Great. So let's begin with patient-centered care, as it is like one of the main purposes um, of discussing interprofessional collaboration and practice. So, uh, as you know, like many health systems are like in the past have been health work doctor or even health workers centered, and this system has not been allowing us as health systems achieving the healthcare needs of our communities, and they are not been able to discussing the involvement of patients in delivering healthcare. For this reason, uh, our health systems needed to shift from a system that is centered around the health workers to a system that is centered around the patients, where the patients can be involved by also shaping the clinical decisions through their values, through their needs and preferences. For example, and the cultural backgrounds can make doctors adapt their healthcare practice and their clinical decisions so they can have the healthcare services accepted by the patients and by the communities that they serve. So this shift from a health worker centered system to a patient centered system makes sure that the patient is involved in in the healthcare delivery and the healthcare services. So they would be these healthcare services not only be of good available and accessible to the healthcare communities and of good quality, but also accepted by their communities and respecting the dignity and the core values and the principles of the communities that these health workers are serving. And not only recently the health systems need to be looking to patients as just clinical cases or as diseases that are presenting to them, but rather they need to be more, there needs to be a shift towards from patient-centered care to more an involvement to people-centered care in order to have have patients are being seen more as people rather than diseases, so they can make sure that the continuum of the healthcare delivery, not only when it comes to disease disease curing, but also disease prevention and health promotion to the communities. So that can serve our communities and maybe let's say our health system be as socially accountable as possible towards our communities. And for this reason, this is one of the main reasons that we need to have um, a system that is less centered on the health workers, and it is more um, a reason that we need the health workers to be working together in order to make sure that they put people and the communities at the center of their healthcare practice, so they can uh, so so all the health services that are received from our communities uh, are not only of good quality but also accepted by the communities. And therefore, we need to shift. We need to have an interprofessional collaboration. We need to understand how to work together as health professionals in order to make sure that we put our communities at the center of our health services. So we're going to discover more in a bit. What does it mean to be to have interprofessional collaboration, and how we can see it from an educational perspective. So let's move to the next part and let's learn now about interprofessional collaboration practice.
Okay, thank you very much. You hear me well?
Yes.
Okay, great. Thank you for this comprehensive introduction. And I want to highlight one statement about patient-centered care. As you mentioned, we have to look to what patient have a disease, not a disease within some patients in the world. So this is the main point, or the main focus point we have to focus on as a healthcare team. But are we truly a team? This is a question we have to think. All of us attend too much, maybe international or national or local events, speaking about universal health coverage. No one should be behind. The human resource in healthcare 2030 strategy, and too many global strategy focusing on how to improve the medical service or the health service for all. And another issue, we have to focus how to improve ourselves. But it's a very important point to look to our performance as a team. As you look to the right side picture, on the right side, this is a patient in the center, and every profession, every single profession deliver a quality service. So for example, she's a nurse or he's a nurse, deliver a quality nursing care. And this one is a pharmacist giving a quality pharmaceutical care. And this is a physician giving the best medical care. And this is a physiotherapist, and so on. But on the left side, if you see this picture, the patient's still in the center, and we focus on the patient. However, we also focus on how to intercommunicate with each other and strengthen our relation as a team. Next, please. Yeah. But if we work together in the hospital, maybe someone will say that we working in the hospital, so we are a team. So just putting people together to work doesn't necessarily produce effective team. So we, the people here, that the nurses, pharmacists, and physiotherapists, physicians, and all the healthcare professions, we already put in the hospital, but it doesn't make a sense that everyone work in his own manner without any effective networking and team working together. If we look to the team word as the abbreviation of 4 words, together everyone achieve more. So together as a healthcare team, every one of us achieve more for the patient and provide a quality healthcare. Next, please. To achieve this point, and to be effective team and work as a team inside the healthcare settings, we have to practice together an interprofessional practice. The interprofessional practice, as abbreviation of IPP, is a collaborative practice which occurs when healthcare providers work within people from the first, within their own profession; second, with people outside their profession, as I mentioned before, with other healthcare profession in the hospital; and the third point, with patients and their families. If we work together at the same profession and work with the other healthcare team and work with the patient and their families collaboratively, effectively, and respect each other, so we already practice the interprofessional concepts. Next, please. So what's our role to achieve the interprofessional practice? We started with the most important and crucial point is the communication. We have to communicate with each other in appropriate language, because when we speak, every profession speak with its abbreviations or their own language, or maybe some countries, the physicians speak in English, the other professions speak in the local language, and so on. So we have to unify our language. You have to unify our assessments. And I think there is one new trend in this communication in healthcare team. It's called clinical reasoning, to unify the voice of communication inside the healthcare settings. So kindly search about this. It will something like will unify our speaking. Next one, appreciate. We have to appreciate the contribution of each other. Every single one in the healthcare settings have a crucial role and have important role, and we have to appreciate this and have to encourage everyone. The third point, we have to respect and build trust among team members. It's very important to respect each other, especially in front of patient and family. It's not allowed and it's not accepted if you want to be like like a star, or you want to be like a good one in front of patient and family, so you will say bad words about the other healthcare professions. It's not allowed and it's not respect, and it's against our interprofessional practice. Next, please. Yeah. The fourth rule, we have to provide other healthcare team members with the information and answers. If any other healthcare team asks something for you, if you discover something, you have to tell the other patient. For example, if one patient, and this I have this experience when from few months ago, that one patient have HCV and the result in the lab work already done, and this HCV positive, but the lab practitioners didn't inform the other healthcare team. So it's very important and to inform others and so on in the information. The last point is support. We have to support each other if even any mistakes happen or any success happen. Next, please. This were a little bit about our role in interprofessional practice, but the most important issue in providing interprofessional practice is to make learn together to work together. So it's our time now. We are the present, not only the future, because we are still students or young professionals. We have to educate and learn together to practice this, and this is what will we know more about interprofessional education and how to educate with each other. Thank you so much, and have a nice time. Thank you.
Thank you, Ahmed.
Okay.
Go ahead.
Thank you. My colleagues have clarified the interprofessional collaboration in the best possible way, and how it's a very big deal, and how is it important for us to empower our health systems. And next, please. So as this is very important, many institutions of healthcare and global health worldwide have defined collaboration, mainly interprofessional collaboration in healthcare, as a core competency for healthcare providers, including multiple competency models like the WHO's 5-star doctor framework, the CANMED framework, which is shown on the left of the screen, as the collaborator competency is one of the major 6 competencies a medical expert should have, and also for other healthcare specialties. So educational framework for the development of competency in dental program also focuses on collaboration in its multiple sections of competency models for dental specialists. Next, please. So what do we aim to achieve through interprofessional collaboration in healthcare? Basically, we want to work with other healthcare providers, but we don't want to have the process just going, but we want to make it effective to provide the best possible outcome. And secondly, working with physicians and other colleagues in the healthcare profession to promote understanding, manage differences, and resolve conflicts, as creating a better understanding of each other's roles and responsibilities, and also definite tasks, will eventually contribute to a better environment of collaboration and also would help us to have better conflict management and conflict resolutions, and would eventually lead to a collaborative environment where we can progress and move with our health system forward. And thirdly is to hand over the care of the patient to another healthcare provider whenever needed, as a very important goal for us here to provide patient or people-centered care is the continuity of the service and the safety of the patient. Next, please. So meanwhile, the screen is loading. We have clearly understood the idea of interprofessional collaboration and how is it important for the healthcare system. Here, the question is how to achieve interprofessional collaboration. How do we get our health systems to be based on IP collaboration? And here, a very simple and logistic answer would be is that if you want to push your healthcare system forward, if you want to progress with your health services, then the most affordable yet the most effective investment that you can create is to work on medical and healthcare education. So in our case, to achieve interprofessional collaboration in our health system, we need to include and invest in interprofessional education in our healthcare students and healthcare schools, starting from the undergraduate studies, reaching to postgraduate and continuous professional development until we can build actual capacity of the healthcare providers to be able to understand and fully implement interprofessional collaboration in the health system. And if we want to define interprofessional education, then it would be simply as when members of two or more health or social care professions engage in learning with, from, and about each other to improve collaboration and the delivery of care. And the goal of these efforts is to develop knowledge, skills, and attitudes that result in interprofessional team behaviors and competence. And here, another question arises, which is, what are the benefits of interprofessional education? And as clearly explained before, it allows for a health workforce that is ready for collaborative practice and therefore for optimal health services, as we previously discussed the continuum of services and collaboration in the field. So for example, if there is a complicated case, hereby the optimal health service would be the comprehensiveness of care, and therefore it requires collaboration starting from the education level. Secondly, it provides more job satisfaction. So if we have better understanding of each other's roles, then it would make our working environment more flexible, more easygoing, more friendly, and therefore more collaborative. And eventually, the end result is a better outcome for the patient and for the community. Hereby, I would like to end my part of the webinar in the next slide by a very nice quote, which says, "You cannot work adequately with other health professionals if you do not understand what they do. But you cannot understand what they do if you do not learn about them, from them, and with them." Thank you very much. And now we can move to the next agenda point.
Thank you very much, Atlan, for sharing with us about the interprofessional education and stressing the benefits and its relation to interprofessional collaboration. So in the next few minutes, I'll be sharing with us 3 examples of good practices of interprofessional education. And just like a bit of an introduction, I would like us to know that there are different approaches to which interprofessional education can be done. We could use didactic approach, we could have approaches focusing on community-based learning, and we could also use clinical simulation approaches, and in some cases, a combination of these different approaches. And it's important to know that these approaches try to emphasize interprofessional team building skills. The students also acquire knowledge of their profession and other team members' profession, and very important, patient-centered care. Next slide, please. So the first example I'll be sharing with you today is interprofessional education for quality use of medicines in Australia. So in Australia, opportunities for healthcare students to engage in interprofessional education were limited by some barriers, such as the timetabling and a large cohort of healthcare students. Hence, to curb this barrier, the school developed some e-learning IPE modules for nursing, medical, and pharmacy students. And the scope of this module was to enhance the teaching of medication safety and quality use of medicines with an interprofessional approach. We all know that prescribing, dispensing, and administering medication safely requires an interprofessional approach, and every member of the medication team should be in communication as to what, when, how, where, and everything. So the outcome of this particular interprofessional education approach showed that the students at the end of their modules had like higher intentions to practice in a manner that enhances collaborative practice, ensuring medication safety for patients. Next slide, please. The second example I would like to share with you today is interprofessional education in a ward setting in Sweden. Here in Sweden, the opportunities for students to learn about interprofessional collaboration and cooperation actually varied greatly between the type of clinical setting that the student was exposed to. So in order to cope this challenge, the schools agreed to have a ward-based educational approach for medical students, for nursing students, and for physiotherapy students, to ensure that every student was exposed to quality interprofessional education experience. For this case, the scope of this interprofessional education covered clinical interventions for geriatric with conditions such as heart failure, pneumonia, and diabetes. And the students had the opportunity to work in interprofessional teams, providing care for about 3 to 6 patients, while also gaining a deeper understanding of each other's roles, responsibilities, knowledge, and skills. The outcomes of this particular approach showed that the students had a positive attitude to teamwork, to communication, and even the supervision that was provided all through the interprofessional education program. And on the other end, the patients who were on readmission to the hospital, because these are older people and some of the cases were chronic, would always get back to request to be sent to the student wards, which could show that maybe to an extent they had some better outcomes or better experience spending time in the ward with the student. Next slide, please. Then this is the third example that I'll be sharing with you today. And this basically was the interprofessional education patient safety workshop held in Singapore. And here, nursing, pharmacy, and medical students from Different schools were made to participate in a one-day workshop focused on patient safety. This was done in collaboration with the World Health Organization, and the scope of this interprofessional education approach was covering the international patient safety goals, which includes identifying patients correctly, improving effective communication, improving the safety of high alert medications, ensuring safe surgeries, reducing the risk of healthcare associated infections, and reducing the risk of patient harm resulting from falls. So this one-day workshop included a series of brief lectures, videos, root cause analysis from actual real case scenarios, role plays and posters, all relating to patient safety. And the students were put into these different educational activities and made to engage with one another and learn together. The outcomes of this showed that 86% of the students, that participants of this workshop over a 6-year course, notified or like agreed that these interprofessional education sessions were actually very good. However, this approach posed some challenges due to logistical issues, scheduling issues, and resources. Having to get students from 3 different schools to come together on one day could be very demanding. So one common theme I would like us to learn from all these 3 approaches is that a successful experience among these 3 approaches includes focusing on students' understanding of their own professional identity while gaining an understanding of other professional roles in the healthcare team. The elements that ensured a successful interprofessional education approach include taking responsibility, accountability, coordination, communication, cooperation, assertiveness, autonomy, mutual trust, and respect for each other. And a successful interprofessional education approach will ensure that the students can experience working in a healthcare team while sharing in the team and also practicing all these elements that I've shared with you with each other. Thank you very much. And I'm looking forward to your questions and comments at the end. Thank you.
Thank you so much. Start.
Can you hear me, everybody?
Yes, we can. Go ahead.
Excellent. So, hello, everyone, and I'm Saad from IFMC, liaison between medical students worldwide and different students organizations, and it's a great pleasure for me to share with you some insights about how we, as healthcare students, can take an active role in implementing IPE and what we can do actively. As you've heard, IPE is a very interesting concept. A lot of thoughts have been shared into it. And now the primary question is what we can do. So the first thing is for you as healthcare student to know that IPE is an important topic and that you as healthcare students have an important role to play in it. So be positive and have a leadership role in that. And also the second thing that we have as students is the process of creativity and energy. So that gives us a big advantage when compared to professors, when compared to other healthcare professionals. So we have this creativity factor, and which also makes us more close to and able to engage in a better way. So things to do are, first, be able to speak and advocate on it. So as healthcare students, first step would be to engage with each other, know each other. If you are a medical student or a pharmacy, chiropractic, nursing student, get to know the other healthcare students in your faculty, university, country, interact with them, and then create your local, national network so that you can have a collaboration going on between each other, and you can have a better and a higher voice. So that would be the step number one, which will allow you then to do a better work. Once you have your local network of healthcare students, what you can do is advocate and present to your professors, to your faculty people about IPE, the importance of IPE now. Also, we have a lot of, there are a lot of international movements working on IPE, so you can always try to find out professors who are part of those international movements and collaborate with them, get in touch with them, so that you can have a support system from your faculty. If I might move to the next slide, please. So in the next slide, there is a list of things that we can actively do once we have our local student network. Mainly, we can do seminars, workshops, projects, community projects, campaigns. And the idea here is mainly targeting healthcare students themselves and trying to educate them, raise their awareness about IPE, because I'm pretty sure that a lot of healthcare students don't have this approach in mind yet. They don't know what IPE is. So it's very important for us to take that active lead and try to share the concept with our friends, our colleagues, educate them by using webinars like this one, workshops on the local level, using posters and sharing materials in social media on the local level, national level. This can always be done and easily be done, of course, between us students. So the goal is to educate our students, our colleagues about IPE so that we know better about it. What you can also do is target professors and stakeholders, educate them too, and raise their awareness about IPE so that they know better about it, and they are more likely to support you and include IPE in the future. So the second point is education and raising the awareness. Also, some things you can do is peer learning, which is really, really interesting and can create a lot of opportunities for us as healthcare students. We as students can do a lot of things and achieve a lot of things with each other. We don't need, like this kind of support system, or we're really autonomic. So if you have this local network of students, healthcare students, you can learn from each other, share with each other. You can have debating cycles, debating topics, like you organize events where healthcare students can come together and discuss topics such as patient safety, such as healthcare workforce issues and problems, how to deal with ethical issues in healthcare. Those are some topics that you can just gather around as students and do some peer learning sessions, and this is very useful. And also, if I might move to the next slide, please. In the next slide, those are two examples of some actions that you can do as students, which is research. Research actually is something that we can take the lead on when it comes to IPE, because it's a topic that uh, still lacks some insight on. And for example, here you can see that there is a peer-led interprofessional simulation experience which shows the improvement of perceptions of teamwork for participants. So that was done as an experiment, like students with professors included IPE in their local in their local level, and then they analyzed and did some research work, and they came up with some really interesting results about the impacts of IPE. Also, the second one, which shows students' perspectives on IPE and experiences, that's also one research that has been done on the national level. So all those research can be done on the national and local level. And also from our side, we are preparing and we will be launching a survey very soon on how healthcare students perceive IPE and the situation of IPE in different faculties. So stay tuned for that. That's our surprise for this campaign. And yeah, as I say, take the lead on research on the local and national level. And that's something absolutely that you can take like a lead actively on in your context. So to sum things up, first, create your local network, get to know other healthcare students in your local and national level. If you need any support on that, just reach out to your international organization and they'll make sure to link you up with other organizations on your national level. Second thing is work on education and raising awareness. Third level is work on advocacy in order to implement IPE in your local context, and work on peer learning just between you students, and finally do some research. So that was it from my part, and thank you for being here in the webinar.
I believe Leborag is here with us. Can maybe have something else to add up or what Sad shared with us?
Yeah, so Sad actually went through it very, very well. Just to add on, guys, like when it comes to IPE, it really takes an open-minded person, because one of the barriers that came up in the research that was done on the student perspectives on interprofessional education and experiences was that people had personal barriers, in that they went into this, or they thought about this in a way that they thought that there's only one way of treating certain conditions. So you have to be open-minded to hear what other students from other healthcare professionals has in mind, and other solutions that can help. And you have to put yourself in a position where you can also learn from that student. So that's why peer learning is such an important thing, because learning from other students is extremely important. And one thing that I have noticed, and um, well, over the years, basically, is it's easier to learn from a peer than it is to learn from a lecturer, or a lecturer type of thing. So peer learning is extremely important, because the ideas and the conversations that and the discussions that come up there are extremely.
Leborag, are you still with us? Yes, he's probably facing some technical issues because due to internet connection. Alrighty then, thank you so much, Leborag. He's facing some trouble joining us, but he will be with us answering questions if you have any. So just to open the space for our members that are joining us from the different backgrounds of healthcare education. We would really like to hear from you if you have any questions or anything that you would like to share regarding interprofessional education, your experiences, or maybe your reflections on how would you need it in your or how can it be implemented in your settings, whether is it medical school or nursing school or any healthcare curriculum that is that you are enrolled in. We would really like to receive your questions, and apparently we have some. We have already two. Alrighty then. So the first question that we have is which interprofessional subjects would you suggest in the curriculum? And yes, so let's answer question by question. So for the first question, like which interprofessional education subjects that we would be having on. Um, from my perspective, I would say that interprofessional education is an educational strategy where we can have on multiple subjects an interprofessional approach to teaching that subject. For example, let's say obstetrics can be discussed from an interprofessional practice perspective because obstetrics and labor, for example, it involves many healthcare professions, such as not only doctors, but also nurses as well as midwives. And maybe, for example, addressing many topics that are related to obstetrics, such as labor or maternal care, postnatal, etc. They can be addressed from an interprofessional perspective. Emergency medicine as well is an interesting topic where we can have a strategy when it comes to interprofessional education because many healthcare education and many healthcare professions are involved in this process. We have doctors, we have nurses, we have many other professions that are involved in this process. I mean, every topic that is where we have needed a more than one profession intervening, and uh, we can have a an interprofessional educational approach. So it's not necessarily about learning one subject, but rather like how we do learn that subject when it comes to healthcare education. So mainly like for each subject, we would learn about, as our friend here, Ahmed, shared with us, the roles of each healthcare profession, the roles of each healthcare profession within the team, and how to communicate with them, and how to make sure that how to collaborate with them when it comes to patient-centered care and people-centered care when it comes to the curative medicine, but also disease prevention and health promotion. All right. Second question, how can the barriers be diminished on interprofessional education? Mm, okay. Who would like to answer this question from our speakers?
Yes, Ahmed, please.
Yes, go ahead.
Hello, can I answer this question, please?
Please go ahead.
Yeah, sure. It's absolutely, we will face too much challenges. Put in your mind that IPE, interprofessional education, and IPP, interprofessional practice, is a change. And we have to focus on change management steps and process. It's not easy to change the minds of the the teaching staff, maybe the student, or even the clinical staff too. We have to communicate with each other. We have to learn with each other. It's not easy. So we have to focus on change management as a process, and we have to read more and more about it. And for the barriers or challenges we will face, the first point, just for example, just imagine yourself go to your faculty of your faculty dean or director and say, please, we have a project to make a IPE or IPP. So the first thing you will face, he will say or she will say to you, there's too much numbers or too many students in nursing students, medical students, pharmacist students, and we have no space to achieve this approach as an educational approach. So the first solution maybe apply the e-learning principles. It's very easy now, and every single student in, I think most of the countries have a smartphone or mobile phone. He can use it or have like a Facebook page or Twitter. We can activate the e-learning principles and e-learning approach in application of IPE. We can record this subjects or seminars about communication and so on and share it within the university or within the national level. So I think it's my point of view, it's applying the e-learning to overcome the problem of number of patients. And as I mentioned before, the change management is very important point to keep in your mind. This is a change and we have to make it. Thank you.
Thank you so much, Ahmed. Does anyone else have something to add as well?
Hi, this is Allison. Thank you very much, Ahmed. I would just like to add that the barriers to interprofessional education, they are actually contextual. So it's to an extent would depend on your country and your region. So the first step to overcoming these barriers would be, from me, my perspective is to actually identify what are the barriers in my own country, and then take some brainstorming and thinking of how to or what you can do to overcome these particular barriers depending on your country and your university before approaching the faculty or whichever stakeholder is involved or would be responsible to implementing this change for you. So it's important that you try to identify, first of all, what are the barriers in my country, what are the barriers in my university, and how will I be able to reflect and work with others to overcome these barriers. Thank you.
Thank you very much, Edison. Great. Anyone else would like to add something? Okay, great. We can move to the next question. Um, how can we apply IPE in our local university? Okay, so just from any healthcare education perspective, it can be applied easily in um, a local university per level or scale. Basically, we can start as healthcare students by organizing non-formal education activities. Usually in our settings, we organize, for example, workshops or seminars for our peers as medical students. Our friend here has shared the importance of peer education and its importance in educating our peers in our healthcare curricula about a certain topic for our education. And it can be as a first step. Non-formal education and peer education can be a first step for us to start applying interprofessional education in our local universities. For example, if you as students organization in a local university can organize maybe a seminar or a workshop uh, for your peers, whether are medical students, nursing students, etc. Or you can have a twist on this educational activity where you can, for example, invite more than one healthcare student from a different healthcare profession to your educational activity, or you can also invite more than one um, educator from a different um, healthcare profession to your activity. This way, you can have an interprofessional approach to designing your educational activity, whatever it is. So, non-formal education can be as a first step towards applying IPE in your university because once you start, for example, promoting this idea among your peers in your curriculum, you, the stakeholders that are involved, namely the university staff and the university educational boards, can uh, be alerted of the need of an interprofessional perspective of teaching healthcare students, and this way they can also be starting moving from a non-formal uh, level to your educational activity to maybe implementing it formally in your curriculum. So this way, it can be, for example, applied in your local university. You can start as a healthcare students organization, and you can afterwards advocate for it within your university. Um, I hope this answers your question. Does any of you else have anything else to add?
Yeah, if I may share some insights.
Please.
Yeah, so as Maru said, it's basically us students trying to take the lead and working steps by steps. It's a change. It does take some time, but if you start with small steps and try to implement small actions or small initiatives, that would be a good start. So, as said before, try to get in touch with local university healthcare students. If you need any support from the international level, do feel free to reach out to your coordinators and they will link you with other healthcare students in your local level. And after that, make sure to have or identify stakeholders who are aware about IPE, who are working on IPE, because that would be a great support system for you. And as I told you, there are a lot of organizations working on IPE, having a lot of professors there. So again, reach out to us from the international level and we can make sure to link you up or identify some professors or stakeholders that can assist you, and from there you can have a support system that can help you start something. And again, we all the materials that we have shared, like the posters, the videos, all the materials we had in social media, feel free to use that in the local level to share the knowledge and the insights. So that's also something you can do on the local level. And when it comes to implementing IPE, you should maybe have some introductions on curriculum design and curriculum advocacy as healthcare students, so you can be more confident on how to approach stakeholders and convince them of the importance of IPE on how to implement it. So that's also something we can absolutely support you with if you need. So those are like some tools that you can always reach out to us for help. And yeah, don't feel shy or hesitate to start something on the local level, because that's the point in the end.
Thank you so much, Saad. Um, Great. I was looking at a certain question, then I kind of lost it. Yes, here it is. Okay. Um, yeah, this is a very interesting question, which is in a setting whereby it says, in a setting whereby certain healthcare students feel they are superior to others, is it really possible that these ones stoop low to say and accept their roles so as to learn along with other healthcare education students? It is really important that like to emphasize that interprofessional education does not only emphasize on the knowledge and the skills that you gain so you can deliver the collaborative practice regarding people-centered care, but also you will get to learn the attitude of collaborative practice and as we have mentioned, the respect and collaborating smoothly within a healthcare interprofessional team, because learning with other healthcare students, you will get to see how much they contribute to the healthcare delivery, and this way you will not feel, for example, any healthcare student will not feel like superior to other healthcare professions because of they will learn how much the other healthcare profession contributes to the healthcare delivery. And this way, they will have more respect to the different components of the healthcare team. And this way, it will be more of an efficient way to understand that we are more of a piece within a great puzzle of the healthcare rather than just uh, uh, there's like a hierarchy which is doesn't really much exist in healthcare shouldn't much exist in healthcare, but sadly it still exists uh, currently. uh, and like interprofessional education is a way to ease that attitude into medical students and into healthcare and into all healthcare students in general, because we need to make sure informally to teach all the healthcare students about the importance of um being a piece of a puzzle when it comes to when it comes to the healthcare delivery, and make sure that we are all contributing equally and of the same importance to the healthcare delivery and to people-centered care.
And if I may add,
Mhm. Please go ahead.
so again, Abdullah from IFMSA. So the best way Sorry, I was cut out. So, what I was saying that this could be a barrier to achieving interprofessional collaboration in healthcare. And the issue here is that we are used to, in many countries, to be separated and segregated from each other. So we have no exposure of other healthcare students during all our study years in school. And instead of getting exposed to other healthcare providers during the actual job, for example, in the hospital sector or in the primary healthcare sector, starting as early as possible from initiating the professional education in your school curriculum, probably from the first or second year, and getting to actually work with other healthcare students from early stages would create an understanding, a deep understanding of the students that they cannot eventually achieve the comprehensiveness and continuity, and also the patient or people-centered care without the help and support of each other. And therefore, we can create a collaborative environment starting from the education stage. Thank you.
Thank you so much, Abdullah. um okay, does any of you else have anything else to add? All right. We can move to another question. One last one, which says, how can the young professionals support students to apply the IPE? Um, it is very important for us to get support so we can, for example, develop educational activities that are interprofessional. Here now, like as um, youth organizations, when it comes to representing healthcare students, we are providing a network for us so we can connect with each other. So we can, for example, implement IPE in not only on a global scale, but also on a university scale. And you can also reach out to your local organizations and see if they have a network that is connected with the young healthcare professionals, so they can also be supporting you and, for example, in delivering educational activities when it comes to from an interprofessional education perspective. So on a global scale, we are trying now to connect with each other as much as possible so we can collaborate and be in touch with each other, so we can not only get to learn about what the other organizations do, but also work on common projects, such as, for example, this campaign that we have now. But also we can help you connect with our local organizations, whether for example, IFMSA, IPSF, IADS, or any other healthcare students organization on a local scale. So we can, for example, connect with the young professionals that would be, for example, even the alumni of each local organization, so they can help you with the, implementing, for example, interprofessional educational activities. This is one of the suggestions that I would like to share with you. Does any of you else have any other suggestion?
Yes, please. I'm Ahmed.
Yeah, go ahead, Ahmed.
Yeah, thank you so much. Really, I highly appreciate this question because the connection and collaboration between the fresh graduated and the students is very crucial to to exchange the experience from the point of view of the fresh graduate and send some direct or indirect messages to the students to prepare themselves before they face the current status or the actual status of the healthcare settings. So it's very important to set some discussion sessions, maybe formally or informal discussion sessions between each other. And fortunately, we have, in most of the countries, we have students networks and like IFMSA in each countries and IPSF and WWCs and so on. So it's very important to start with like a committee or task force or even a project to make it monthly or quarterly discussion session as a platform discussion sessions between each other to exchange the point of view from the fresh graduated and the younger professionals and the students. And also it's assure the sustainability of this project. So really it's very important to set discussions sessions with each other. Thank you.
Thank you so much, Ahmed.
Yeah, and also, so again, Abdullah from IFMSA. I was saying that supposing that you're a recent graduate and you want to also contribute to this work. So once you graduate, your contribution towards medical education is not limited, because you can either contribute through continuous professional development and education and try to like extend your medical education towards postgraduate level and to try to keep the learning cycle going on. Or also, you can also contribute to undergraduate levels by keeping communication with your faculty, with students and local student organizations from your faculty. And for example, in this case, you can reflect on your personal experiences. For example, if you're not exposed to interprofessional education during your undergraduate curricula, and then you got exposed to healthcare providers during your residency, for example, or whatsoever, and then you face difficulties or issues in your personal experience, then you can reflect on that, try to create a proposal or something, or explanation, or whatever document that you can present to your faculty to express that you have faced this and this problem due to deficiencies in certain educational modules, and eventually contribute to the whole advocacy cycle of IPE, and then help other with more fortunate medical students to have more exposure to interprofessional education and interprofessional collaboration in their med schools.
Thank you, Abdullah. We have two more questions. In a low income country, if someone would like to know if there are some grants available for supporting healthcare activities for the universities, especially when it comes to interprofessional education. Anyone would like to answer this question?
Yes, Abdullah again. So personally, I'm not very sure if there's something specific for IP, but for medical education in general, there's this very prestigious and authorized organization called AMI, the Association of Medical Education in Europe, formerly and currently the International Association of Medical Education, that have multiple awards. For example, they have the AMI Student Initiative Awards for student work. And you can, for example, if you're organizing a student-led project on IPE, you can enroll this and participate in the grant. Or there are also another option, which is the AMI Aspire Awards. And it's basically for pioneership of medical schools and medical education. So if your school started or already implements interprofessional education, then this could be a great opportunity for the med school itself, where they can participate in the AMI conference with the presence of around 4,000 medical education enthusiasts and experts from all over the world. And eventually you might be fortunate to get the prize. On the student level, I believe every student organization has its own awards or prizes, or whatever. For example, in IFMSA, we have our Rex Crossley Awards and activity fairs that you can enroll your projects in our programs and then apply uh, to represent your project in our awards, and probably you can win and get a grant or fund or support for your project. Thank you.
Thank you so much, Abdullah. And just to wrap all the questions, I just had some requests in the question section about sharing the resources. And when it comes to interprofessional education, I'm really happy that to see many of you are interested in organizing campaigns and wanted to raise awareness about your peers when it comes to addressing interprofessional education in your curricula. So do not worry, that we will be sharing with you very soon. Just an example, in I think Mexico, we had with us in this webinar the chief of the International Relation National Office of the Mexican Nursing Students Association, and they are interested, for example, in July to do to gather around so they can discuss interprofessional practice and education among themselves, so they can see how to implement it on a national scale. This is something to congratulate, as well as to all the local initiatives, so we can echo the global campaign when it comes to interprofessional education. Um, I think we need to wrap up our webinar. Um, Thank you so much for your engaging with us and being present for this very important question when it comes to interprofessional education and collaborative practice in healthcare. Our campaign still continues when it comes to this topic. It's not just done yet. We are going to be sharing a survey very soon, so we can see and hear from you your own opinions when it comes to how much interprofessional education is implemented in your curricula. So just stay tuned to our social media and to our mailing lists. We will be sharing with you a survey very soon. On that note, I don't have anything else to add. I would like just to thank the speakers that are present with us. Um, um, thank you so much for sharing your opinions and perspectives with healthcare students and answering all the questions that are have been shared here. Um, yes. I'm just like looking at the messages. Thank you everyone so much for being present, and looking forward to hearing more from you very soon when it comes to interprofessional education. So if you have any question when it comes to interprofessional education, if you are interested in implementing an interprofessional education activity in your NMO locally, make sure to, for example, contact your organization you are affiliated to. For example, if you are a medical student, make sure to contact IFM the same, or if you are a chiropractic student, make sure to contact WCCS, etc. So we can make sure be the liaison to you, so you can have uh, the support that you need regarding this matter. Um, and yeah, with this note, I would like to end this webinar and thank you so much for joining.